In 1984, I found myself in Western Kenya. There I worked on the women's ward alone for 4 months, taking care of 42 women in 14 beds. The women were wonderful, stoic, caring, helping each other. It was a difficult experience. We lost a lot of patients, and often we didn't understand why they died because our diagnostic capabilities were so limited. But after that experience, I understood how important it was to have physicians in the United States experience caring for patients overseas.
The Global Health Residency Fellowship pathway was really the brainchild of Victor Zhao. He asked Ralph Corey to begin this program, and he wanted this to be a program that was broadly applicable across multiple specialties. Our particular pathway that we've charted out is that of a research pathway with an eye towards improving policy and practice so that we can help to improve health disparities and resource-poor settings across the globe.
When I was finishing residency, I knew that I wanted to do cardiology in low and middle income countries. And at the time, many of the other places I looked at really didn't see global health and cardiology mixing well. But what Duke really allowed me to do was to start a global health track that currently exists within our cardiology fellowship program.
The Global Health Residency Fellowship pathway includes specialties such as medicine, neurosurgery, psychiatry, general surgery, emergency medicine, infectious diseases, cardiology, obstetrics and gynecology, and pediatrics. And to date, we've had trainees from all of these programs involved in the Global Health Residency Fellowship pathway.
Once I realized that I wanted to do global health and recognized that there was this really burgeoning field of global health nephrology that no one's really looked at, no one's done much, I thought this would be a great opportunity for me to move into a field and to develop a career in that area.
We have this bracketed didactic experience. On the front end of that is a site assessment for about 6 or 8 weeks at the location where our trainee will ultimately conduct a research project. Then they come back and they engage in significant coursework in the Masters of Science Global Health training program. Then they go back overseas on the back end and spend about 7.5 to 8 months or longer in some cases actually implementing their research project.
To have protected time to engage in international research and have access to Duke faculty. Those types of opportunity that this program provides are priceless.
Duke offered the most in-country work to do both research and to do clinical work. And they were also the only ones in terms of having actual OBGYNs from the institution who were actually, on site in country.
Being able to live and breathe and see on a day-to-day basis for an extended period of time, that's the only way that you'll truly understand the nuances that will enable you to decipher and figure out what are the critical research questions, what are the barriers to care that are occurring, what do we need to provide the communities that have less resources.
We want our trainees to be equipped with the tools that it takes to learn how to be good researchers, and that's why we emphasize rigorous research methodology in our didactic coursework.
One of the big advantages of being in the master's program was just sharing classroom space and time with people from a lot of different backgrounds. I went to Eldorado initially with a project that I designed with someone else in the infectious disease division, but once I was in the master's classes doing that coursework, both the professors for the classes and my fellow students were doing all sorts of different things that I would learn about and get interested in, and had the opportunity to have collaborations grow out of that.
And not only are we focusing on research methods and designs that you would not otherwise gain in residency, but we look at global health policy and sociology issues and economic issues with an understanding that tackling the problems of global health is not just a medical problem, it's a multidisciplinary approach. And that, I think, is what sets the program apart.
As we built this program, we've tried to be flexible and adapt this program to the needs of our trainees. We have a biostatistician just down the hall. We have a regulatory coordinator who has years of experience, and we also have opportunities for our trainees to access multiple supplemental funding streams.
I've consistently felt like everyone is very focused on helping me to develop. Like, I'm not just going through a set program, but people are trying to help me get the most out of this program based on what I want it to be.
I've been able to come up with a research project on something that I was personally interested in. I've been able to design, implement, and analyze a randomized controlled trial among motorcycle taxi drivers in Tanzania. Being able to have that kind of experience in residency is just so rare.
It's not common to have a year's worth of time in a mentored clinical research environment that allows residents to go abroad to a site that is vetted by the university, where there's active clinical research going on, where residents and fellows can plug into ongoing projects or create novel projects and expect to be successful.
It was clear to me that Duke was a leader in the field in global health, and that they were also very committed to training people properly and doing global health work in a collaborative and a sustainable way.
They understand that so much of global health work is about relationships, and the things that you uncover in terms of needs and ways to help really come by building the relationships over time, not just like a quick visit. So they get that, and you can tell that they get that.
We have lots of people coming together around one focus, and that is global health. And it's not just an academic area of interest. We want to do something in the world that will benefit other people. And it's great to see so many people from so many different walks across the university coming together that are passionate about addressing health disparities.
Caring about people is the most important thing that we can do as physicians. We're not the important part. The patients are the important